Hi, I'm going to demonstrate the other technique is the movement with mobilization. So when we talk about the spinal statement, usually we will talk about the name is the apophyseal glide, so including the lateral apophyseal glide or sustained lateral apophyseal glide. So when we talk about the peripheral joint, so say for example the common joint is elbow and ankle. So we will describe as the movement with mobilization. So please don't get confusion because if you talk about MWM for the spine, this is not correct. So MWM always related to the peripheral joint. So movement with mobilization, we apply the same concept. We will do the mobilization for the target joint. At the same time, we want to involve the movement from the patient. So I would like to use this elbow as example to explain the problem first. So I think you heard about some problem related to tennis elbow. They have some predisposing factor. Maybe they have the injury of the elbow joint. So sometimes because of the articulation, the humeral joint, the articulation is not in a good alignment. Sometimes that will limit the extension range. So we aim for those patients suffering from the full extension range, so maybe limited extension. So we can use this technique to improve the extension. The other problem that's related to this, the complex, the humeral joint full extension is the position of the radial head. So if you still remember, if the patient cannot have the limitation to do the full supination, sometimes they can't fully extend the elbow. So this technique also is good to this kind of the patient because of the proximal radial joint problem. We can help them to achieve the full supination range in order to gain the further elbow extension range. Okay, so I want to demonstrate my technique to the bone first before I apply to Daniel's the hand. So we will position the patient in supine position. So usually we will have the couple force. We have two hands. So if I want to treat his left hand, left elbow, so I will use my right hand to contact with the humerus. So generate the force in this direction, like this. At the same time, by the other hand, I will position myself to the proximal ulna, the medial side. So in this way. This side will be relatively distal of the radius. So we generate the force like this in this way. So now I will generate the force. You can see what happened at the radial on the humeral on the joint. So we will have some change of the alignment. So we usually start from the position from the slightly elbow flexion and then ask the patient to do the full extension. I will maintain this force. So this is my passive force, and he will do the active extension at the terminal end range. So the patient need not to suffer very big flexion range, just the limitation range from the slightly flexion position towards the end range. So we will repeat around 5 to 6 times again in this way. So however, for some patients, they suffering from the post-meridional joint problem or the other factors like the very tight pronator, so he can't achieve to the full supination range. Sometimes on top of this force generation, we can add the rotation force a little bit in order to facilitate the pronation, the full supination when he do this technique. Okay, so I hope you understand this basic concept. I'm going to apply this technique to Daniel. So Daniel actually, to a certain extent, have some limitation in the full supination, but he has the full range of the elbow extension. So I can't evaluate the range using this technique, but I want to show you the technique. So again, as I mentioned, I will ask the patient slightly fast the elbow a little bit. I put my hand in this way, my palm in this way. So from here to the bone, actually, there's some soft tissue, right? We need to ensure that we're touching the bone. Same concept apply to the ulnar bone. So we will generate force like this. Okay. So now I will do the rotation. Depends if the patient have no supination problem. You just ask the patient to do the full supination. Can you do it? So yes. he can able to maintain full supination, but I want to add the supination in this way, rotation range. Okay, now with this 5-time extension, are you ready? Ready, go. Okay, extension fully. Maintain the force. Return to neutral position. We still contacting the bone. Second time. Okay, less. Okay, third time. Less. Fourth. Less. And fifth time. Less. Okay, so we aim to measure the extension range again, of course, but because it is normal, so I can't show you the change. So this is a demonstration for this movement with mobilization for the elbow joint. So I think this is quite common. So if you learn this, you may have chance to apply this in the future.